So in this short video clip, I want to talk to you about what to expect when you first come into our office as a new patient. Now, as a new patient, for most situations, I've never met you. I've never met your family or your friends, anybody that comes into the office. In most situations, we're going to do a full exam, and in that exam, we're going to get a complete and thorough history. You might have had traumas, you might have had motor vehicle accidents, you might have had things going on, different traumas throughout your life that we never know about. We might have had surgeries in your spine, surgeries in your body that are very important for us to know about. So we always do a full history first. We always do something called palpation, which is I want to feel your spine. I want to feel if there's restriction in motion, if there's a vertebra that's shifted out of alignment. So we're going to check that with feel. It doesn't matter what age you'll do, we'll be doing that. We're always going to check posture, because one thing we always want to look at with posture is make sure you have symmetry of posture. Because if you're standing up right, but one shoulder's higher, if you're standing up what you feel is the right posture, what you feel is normal, natural, but one shoulder is higher, well, that tells us that you possibly have some issues going on internally in your spine where the bones that should be lined up are actually shifted out of alignment. So we'll check your posture. We also check range of motion. One thing that's key with range of motion, we want to see if you have symmetry of range of motion to both sides. Symmetry of range of motion is a very important indicator to make sure your spine and your nerve, all the joints in your spine are healthy. So we'll check the symmetry of range of motion. And for most patients, not all patients, because some patients are going to be pregnant, some patients are going to be infants or kids. So for most patients, we'll actually be taking x-rays of your spine as well. Those x-rays tell us a lot about the actual alignment of your spine. Now, in another video, I'm going to talk to you about the proper curves that we should have in our spine, the proper alignment, and I'm going to even talk to you about scoliosis, because we do some work with scoliosis and we do some work with curve restoration. And so we'll talk more about that in other ones, but that is a typical exam. That's a typical exam in our office. After we do a full exam, I like to take the time to go through and review all of the x-rays. I like to take time to review the posture, all the findings of the posture, the range of motion, the palpation, your full history. I like to review all of those things before I can tell the patient, yes, I can help you with what you have going on, or before I can feel confident in knowing that, yes, indeed, this is the right place for you, we can help you with what you have going on. And then after that visit, we'll set up a follow-up visit. It's a report that I go over with you. I spend an extra 30, sometimes 30 minutes up to an hour going over with you in detail exactly what we found in your x-rays, exactly what we found in your posture, your range of motion, all of those things. And then exactly how we can go about helping you improve those things if there is in fact problems with that. So I hope that helps you understand the day one process where a new patient comes into the office and how we also follow up with that. In other videos, we'll talk about scoliosis, we'll talk about curve restoration, we'll talk about insurance, things like that. So I hope this helps. Have a great day. We'll see you soon.